Radio Hinuman Flash Report.
Patayin ka man nagatabi diri sa aton nga pagpangalagad sa Alagad Radio 100.5 FM. Sa kabugusan nga puwersa naman sa local government unit diri sa Banwa sang Hinubaan. Sigo nga oras, sigo na sa inyo orasan, Alagad Radio Philippine Standard Time 13 minutos na nakaligad sa takna nga alas 11 sang ugto. Pagpangabi-abi sa mga katapo sa aton local government unit headed by our Mayor-elect Mayor Duff Reliquias. Subuman sa aton anay amay sang Banwa, the public servant Mayor Ernesto Estrao. Back-to-back sa presensya man sa aton local legislative office. Ang aton presiding officer headed by Vice Mayor-elect ang magatapos nga sinitermino, Vice Mayor Jeffrey Lasalita Incoy. Talos kita nga magapangalagad sa inyo sining palatuntunan sa karon tay ap kita to nga ontang slot sang pulo pasiplat. Inyo amigo si Papa Berta. Dire sa Alagad Radio 100.5. Sa nga kagupisi naman sang Promotion and Information Office headed by ang aton Iloy sang PIO. Mami Dalia Valenzuela Rilado. Sa pagiyaman sa aton Program Director Sir Nyrel Papa Kevin Matthew Mulaben. Subong adlaw dalon ko sa inyo ang latest update na nungod naman sa opisina sang aton nutrition office ni Papa Kebs. We have here sa aton sinipresensya man kaupod na ton Ma'am Mercy Parkon. Good morning, ma'am.
Yes, okay,
ma'am.
good morning.
Yes, ma'am. Go ahead.
Mayong agagid sa tanan. So, magasugod ako.
Yes,
okay,
ma'am.
antes mananyaw man ko sir sa aton nga pinalangga nga amay sa Bano sang Hinubaan si Honorable Anthony V. Reliquias, ang aton nga Vice Mayor Jeffrey Lasalita Incoy, SB members, department and section heads. Sa duha ko kaupod dire subong si Ma'am Emmy kag si Sir Philbert. Ang akon nga boss si Ma'am Mildred Villamater and Dr. Rowena si Abilia. Sa mga empleyado, tanan nga sa gobyerno, punong barangays, BNS, VHWs, kag sa tanan nga nakabati sini nga programa, maayong aga liwat sang tanan. So, sini nga tion, amon i-discuss ang party sang Nutrition Month celebration wherein maga-celebrate kita sini nga bulan sang July. So, ano ang tema sini nga selebrasyon sa 2022? New normal na nutrisyon, sama-sama nating gawang solusyon. So, ano ang buot silingon sang Nutrition Month? Ang Nutrition Month is an annual campaign wherein i-held siya sa July to create awareness among Filipinos in the importance of nutrition as provided under Presidential Decree 491 or the Nutrition Act of the Philippines. The law mandates the National Nutrition Council to lead and coordinate the nationwide campaign. So as I have said, nga ang aton nga tema amo ang new normal na nutrisyon sama-samang gawan ng solusyon. So the theme calls for the strengthened nutrition intervention and solidarity towards nutrition improvement as the countries shift towards living with the COVID-19 virus. The theme signifies the key role of nutrition in building resilience from the pandemic to endemic paradigm. The term new normal was adopted to indicate a transition to a better normal while bringing the position impacts of the pandemic to become more resilient and prevent future pandemics. The pandemic made a huge impact on nutrition, such as disruption of delivering nutrition and related services, increased hunger incidents, and others. But there are also positive impacts, such as innovation in service delivery, home food production, increased awareness of one's health, and consuming healthy diets and solidarity among the people to help each other. So, what are the objectives for this 40th Nutrition Month celebration? So the campaign for a collective effort to improve nutrition as we move forward to a better new normal. Raise the awareness of the importance of nutrition in building resilience and recovery from pandemic. Then stimulate discussion among stakeholders on how to build back better the design, delivery, and scale up the nutrition intervention and engage various sectors and the public in activities that promote nutrition. So what are the key messages? Number one is good nutrition is key to building immunity, protecting against illness and infection, and supporting recovery. Efforts to preserve and promote proper nutrition must be part of pandemic resilience strategies. Number two, promote and adapt health enhancing nutrition behaviors, including the consumption and sustainable health diets. Number three, call for continued solidarity to support food and nutrition security, especially for the most vulnerable. And number four, expand multi-sectoral engagement to scale up nutrition intervention. Strengthen leadership and governance in nutrition across all levels to achieve nutritional outcomes of the Philippine Plan of Action for Nutrition. So how has the COVID-19 pandemic affected nutrition? The COVID-19 pandemic has undermined nutrition across the globe as the governments impose various restrictions. In the Philippines, the lockdowns and restrictions limited movement of the people, goods, and services, which essentially slowed the economy. These consequences are bound to impact on nutrition, likely on increase in malnutrition, disruption in delivery and availment of nutrition services, hunger, food security, food availability, accessibility, and food utilization. So what are the positive impacts brought by the pandemic? The negative impact of COVID-19 on health and nutrition has been persuasive and undeniably challenging to different sectors. However, there are still positive changes that have been made by living in the virus that can be brought as we shift from pandemic to endemic, like the innovation in service delivery and capability building, attitude towards health and nutrition, and how the pandemic changed delivery of nutrition and related intervention. So as the result of the enforcement of the quarantine measures nationwide starting in 2020, the movement of food and necessities was affected, and the delivery of various health and nutrition services. To ensure that these services will be continuously be provided to ensure the health and nutrition of the people, the Department of Health and other government agencies had issued various guidelines on the delivery of essential nutrition services. The DOH issued Department Circular 2020-167 on the continuous provision of essential health services during the COVID-19 pandemic, including intrapartum and newborn care, especially promotion of exclusive breastfeeding, management of malnutrition, and micronutrient supplementation. Infection prevention and control practices are to be observed. Similarly, the Department of Social Welfare and Development issued Memorandum 12 Series 2020 for the continued implementation its supplemental feeding despite the pandemic. So what are these programs? The micronutrient supplementation, dietary supplementation program, promotion of proper infant young child feeding, management of acute malnutrition, growth and development, monitoring and promotion, and in nutrition in emergencies. Then how the new normal defined? After living for more than 2 years with restrictive measures and still with the threat of COVID-19, the country is slowly transitioning the new normal of living and adaptation. Although no one definition exists, the new normal in the general context is characterized by the need to observe the social distance, strict personal hygiene, and other sanitation protocols, wearing masks, bringing hand sanitizers and alcohol, and frequent washing of hands will continue to be the norm. Though characterized by uncertainty and voluntarily, the policies and standards for health will be cornerstone during the new normal to achieve a steady state of low level or no transmission. So, why or what do we aim for the nutrition in the new normal? So, raise awareness on the importance of nutrition in building resilience, better design delivery and scaling up of nutrition intervention, and promote adoption of health enhancing nutrition behaviors, including consumption of sustainable healthy diets, and increase support in food and nutrition security, especially the most vulnerable. So, sino-ning mga vulnerable? Those ang mga pregnant women and the preschool children, especially the nutritionally at-risk preschool children aging 0 to 59 months old. Accelerate hunger mitigation intervention and prevention and management of non-communicable diseases. So, what are the opportunities for nutrition in the new normal? Advocacy under new leadership and then at the national and at our local levels. Full devolution under Executive Order number 138. Development of successor PPAN for 2023-2028 and its operationalization at the local level through Local Nutrition Action Plan. And what are the roles of stakeholders to improve nutrition for a better normal? So, for the national government agencies, they are committed to action toward eliminating malnutrition and building back better, moving forward to new normal. For our local government units is to formulate and implement local nutrition action plans and align with the PPAN 2023-2028 and increase support to nutrition programs under implementation in considerations changing in delivery brought by the pandemic and improve access to nutrition and related programs in far-flung barangays or the GIDA areas, the geographically isolated and disadvantaged areas, and the resettlement areas. For the private sector, they have to modify the plans and budget to include nutrition-related activities and services to employees and clientele. And for the media, develop materials for information, education, and communication for nutrition messages to the public. promote good and healthy nutrition practices in commonly consumed media like film and television as well as digital media. Encourage the public to participate in national and local health and nutrition programs and stop calling for donations of milk formula contrary to the Milk Code or the Executive Order 51. For the civic society, advocate the increased attention to food and nutrition security. Empower communities to support programs and for the prevention of malnutrition and scaling up nutrition in the new normal. Then work with the government in strengthening efforts to address malnutrition and widen the reach of nutrition programs to areas with less access to health and nutrition programs. Join the Scaling Up Nutrition Civic Society Alliance. And for the academy, conduct webinars, online fora, and other activities to increase awareness on malnutrition prevention and importance of nutrition in recovery. Involve school and university constituents in participation in malnutrition reduction and promotion nutrition programs. Include extension programs that promote good nutrition to the public and improve information dissemination on nutrition in the curricula. Mobilize school-based groups and student organization in their initiatives in the promotion of good nutrition. So for our individuals and families, eat a healthy and well-balanced diet using the Pinggang Pinoy Guide. Increase the consumption of food rich in vitamin A, C, E, B6, B12, such as citrus and dark green leafy vegetables, and maintain an active lifestyle. Avoid smoking, alcohol, and drugs. Drink 8 to 10 glasses of water every day and avoid sugary drinks. So ano ang aton mga support sa aton Nutrition Month celebration? Sa LGU, ginamitingan na ni from the Municipal Nutrition Committee that we have to hang a streamer featuring the Nutrition Month celebration theme. We have also this campaign, the media, and the feeding program to all 13 barangays. So, that's all for the Nutrition Month, and we have to padayon sa aton nga i-discuss ang Operation Timbang. So, Operation Timbang or the OPT 2022. So, ay ano ko ang results ang aton nga OPT or the Operation Timbang nga ginaheld every first quarter of the year for the 0 to 59 months old preschool children. So this is our baseline sang atong mga intervention or strategies sa aton nga mga nutritionally at risk nga mga kabataan. So for the population, we have 59,660 for 2022, and the estimated number of preschool children aging 0 to 59 months old is 5,904, and the total preschool weight is 5,256, and the percent OPT coverage is 89%. So there are three parameters in getting the nutritional status of the 0 to 59 months old preschool children. One is the weight for age, length height for age, and the weight for length height. For the weight for age, we have severely underweight. There are 32, underweight is 92, normal is 5,118, and the overweight is 14. So the prevalence rate, the highest nga nakakuha sang prevalence rate nga barangay nga 4.36 Sangke. Number 2 is 3.02 Alim, and number 3 Kolipapa 2.92. For number 4, 2.82 San Rafael. Number 5 Asya 2.45, number 6 2.45 same Bakuyangan, number 7 Bulwangan 2.17, number 8 2.03 Damutan, number 9 Barangay 1 1.98, number 10 1.95 Barangay 2, number 11 1.57 Dawog, number 12 Barangay Talakagay 1.42 and number 13 Pook 0.99. So amo na siya ang aton nga percent OPT prevalence rate. So i-compare naton ang 2020, 2021, 2022 for the weight for age. Ang prevalence rate for 2020 is 2.81, 2021 is 2.55, and 2022 is 2.36. So number 2 parameters is the length height for age, wherein ang katas-unon kag ang edad sa bata aton gina-combine. For the severely stunted or mga kapututon, 39, stunted is 85, normal is 5,038, and tall is 94. So ang number 1 nga kadamo gid nga mga ang prevalence rate sang stunting 9.46 Damutan, Barangay Damutan. Number 2 Alim is 4.87. Number 3 Kulipapa 2.60. Number 4 San Rafael 2.54. Number 5 Asya 2.45. Number 6 Bakuyangan 2.04. Number 7 Sangki 1.82, number 8 Bulwangan 1.81, number 9 Barangay 1 1.58, number 10 Dawog 1.57, number 11 Barangay 2 1.56, number 12 Pook 1.32, and Barangay Talakagay 0.85, number 13. So, i-compare natin ang 2020, 21, 2022, ang prevalence rate for length height for age, 2020, 2.81, 2021, 2.44, and 2020, 2.36. So, the number 3 is for the wasting or the weight for length height. So, the severely wasted, 22. Moderately wasted is 35. Normal is 5,173. Overweight is 18. And obese is 8. Number 1, Barangay 1 for the prevalence rate for wasting, 3.56 for Barangay 1. Number 2, Barangay 2, 1.95. Number 3, Dawog 1.57. Number 4, Alim 1.16. Number 5, Asya 0.39. Number 6, Pook 0.33. Number 7, Kulipapa 0.17. And the rest 0%. So if we compare that for the 3 consecutive years, 2020 for the prevalence rate of wasting 0.41, 2021 0.75, and 2020 0.49. So that's all for the operation timbang result. So sa nutrition may ginatawag man kita nga vision, mission, and goal. So gusto ko gid sa aton i-discuss kay para pud mabalaan sa kanginan sa aton mga kaupod o sa atong mga pumuluyo ang aton nga vision. So to improve the nutrition situation in all identified priority areas and population groups whom at risk for malnutrition and effective efficient delivery of the 5 impact programs as the integral component of the local development plan. So our mission is to intensify the nutrition plans and programs for implementation at the community level by the LGU, other government agencies, non-government, and people's organization. So our goal is to nutritionally healthy Hinubanon. That's all, and thank you very much for this opportunity.
Radio Hinuman. Fresh Report.
Ato nabatian ang kaundan sang presentation sa karon sang Nutrition Office. Okon sa nga opisina sa aton local government unit diri sa Banwa sa Hinubaan sa pagpaluntad man sang latest information nanungod sa lakat sa ila sinima activity. May kang tanan ang nutrisyon, espesyalmente sa aton sinay mga kabataan kag pumuluyo diri sa Banwa sang Hinubaan. Thank you gid Ma'am Mercy Parcon sa imo sini presensya kaupod man ang imo sini mga kaupod sa pag-present diri karon. May kang tanan sa inyo sini presentation kag buylog nang inyo sini opisina back to back man diri sa Alagad Radio 100.5 FM. Magasunod na ang aton palatuntunan pulo pasipla, ang aton noontime radio segment Lunes hasta Biyernes diri lang sa Alagad Radio 100.5 FM. Ang aton oras, las 11:38 sang aga. Mabalik kami pagkatapos ng pila naton ka mga importante nga segue. Stand by.
Playing more music than the others. This is
Alagad Radio 100.5 FM. Ang inog sang Hinubaan.
Huwag nailain pa.
Lami, oy.